practicing RN for 30 years, and I've been in healthcare IT for about 18, 19 years. So as an example, I was responsible for planning and implementing the upgrade to the software for the sleep center. Right now I'm working on a project for the orthopedic surgeons, and we're about to install a new EMR, so that's really exciting. So my job is great because I pretty much get to work with everybody in information services, from other project managers to the actual analysts who build and test the systems, to the network server guys, the desktop people who do our office software, to my boss, who is the chief information officer, and then the directors and the managers. So I get to work with pretty much every role in healthcare information systems. I was a case manager, and they said, hey, you know, would you consider being a super user? A super user is somebody who has more training or earlier training in the system or in the application, and so they help people, other people who come after them, who get trained afterwards. So I fell in love. I fell in love with the technology. Pretty much held every role except for chief information officer. I teach for Bellevue College. It's a certified professional in health information management systems. And I teach to prepare the students to take the certification exams. Just basic use of Microsoft Word, Excel. These are skills that we use every day, and I think that people who have them take them for granted. If you're a clinical person, you never have to touch Excel or Access or maybe PowerPoint if you're in management. But it was just, I would have loved somebody to say, hey, you know, make sure you have a competency with just basic Office. Probably analysis, planning, and testing. That's part of nursing. You assess your patient, you plan for the care, and then you evaluate how well it did or didn't do. You do the same thing in healthcare information technology. So analysis, but analysis of a system or analysis of a workflow, planning for a system, planning how to implement it, testing, and then evaluation, so you come full circle. I guess make sure it's real world. So I wouldn't want somebody to be in a program that is still teaching and talking about ICD-9. So just, you know, real world as opposed to just the theoretical. I speak both languages. I speak healthcare and medical and nursing and doctor, and I also speak techie, making sure that the clinicians understand what the technology can do for them or can't do for them. And then it's going also back to the pure techies to make sure they understand that clinicians' focus is the patient. The patient always comes first. I'm always going to be a nurse, but what I do, it's a different specialty like pediatrics or oncology or surgery. What I do helps improve patient care and helps improve clinical practice. So that's why I come to work.